Great.
Okay. Okay, the session is already recording, and I think it's actually started. So great, I guess. Welcome, everyone. I can see there are a few people attending the session already. Is everyone able to view the slides and the session properly? Good. I guess then we get started. Thank you. Thank you for joining in. I'm just going to take one more second to check if we are all on the main stage. So maybe if I can ask, Rosie, you are in the session. Can you hear us, see us, and are you able to add any comments? Okay. Yes. Okay, all is live. I've got a go ahead from the organizers that all is live, and we are indeed able to, reach out to the audience. So I think we can actually start. So it's great to have everybody here finally. Welcome to the session. We have about 1 hour in the session to discuss our individual work on climate solutions. And I'm very happy and excited to hear what everyone is doing. What we should talk. I'll just probably quickly go through some of the general rules. So it's about. I think we can take about 10 minutes per presenter right at the beginning. So maybe 6 minutes for each presentation and 4 minutes of direct questions. So that's 5 of us, which should be about 50 minutes, and we can have about 10 minutes of a wider discussion in the end. And I'll try and give everybody a bit of a heads up after 5 minutes of the presentation. Is that fine? I'll please try and stick to the limit, and I'll do that as well. I'll also ask maybe one of you if somebody can volunteer to do the same for me when I'm presenting. So that would be great. Farah, thank you for doing that. Great. Cool. So let's I think get started. First up is Niklas, who will present his work on carbon pricing. Niklas, please share your screen.
Yes, thanks a lot. Yes, so I'll present our work on the effectiveness of carbon pricing, a systematic review and meta-analysis of the exposed literature. My name is Niklas Döbbeling, and this work is done with a larger group at MCC Berlin. For the general motivation, there are quite a number of climate policies enacted worldwide. There's a growing number of exposed studies on these policies, but what is yet missing are systematic reviews on what evidence there is on these climate policies. So for this research, we have try to answer the question what carbon pricing policies are able to reduce CO2 emissions and how effective they are in doing that. The primary studies that we're looking at are using observational data, so quite heterogeneous study designs. And we also found 3 recent literature reviews. None of them is using formalized evidence synthesis to look into the evidence on this research question, and therefore only arrive at rather vague conclusions. The outline of our research is that we uploaded our research protocol to OSF registries. We search for literature databases and Google Scholar, extracting more than 16,000 primary studies. For the title and abstract screening, we use a computer-assisted method so that we don't need to look at all 16,000 studies. If you're interested to learn more about this computer assistance, I would suggest you to watch the session 10.3 of this conference where Max Callaghan is presenting how this works. Then for the full text screening, we go as normal, fully manual, go through the studies. So far we have identified 83 relevant studies. We are not yet completely done with full text screening, but yeah, a few studies might be added still. For the critical appraisal, we considered to use the Robbins I risk of bias assessment criteria, but we didn't see it fit completely well to our task to like the studies with observational data. So we rather simplified it a bit, but we're looking at the selection of study objects, the handling of confounding factors, and how the statistical
Sorry, I
method.
can't hear Niklas anymore. Is
I can hear Niklas, but Niklas,
Niklas, are you still with us?
I
I
think
am.
your screen share might be stuck on your first page. It hasn't moved. At least not on
Okay.
my side. Up, there we go. No.
Now you can see it. If I
Yes.
go to full screen again, and Tarun, can you hear me again?
You might need to switch the presenter mode. Might be, do you have two screens maybe?
I don't, but I think I'll just have it in this mode if that is easier.
That works, yeah.
And Tarun, can you hear me again? Okay.
I can hear you.
If it's only Tarun, then unfortunately I will need to move on. So for yes, so after the critical appraisal, we extract all effect sizes from each study. Usually they're coming from regression estimations. And we harmonize these effect sizes to represent percentage change in carbon emissions. So we're not using partial correlations here, but harmonize the effect sizes in that way. And then I'll present to you some preliminary findings of the synthesis. Our data set, you can see here on the right-hand side, includes a number of policy implementations worldwide, but we still identify a large research gap. So of the 68 carbon pricing policies that we know are implemented worldwide, only 18 are studied. And you also see that many of the interventions are only studied in 1, 2, 3 studies, so also not too robust evidence there. For the methods that I use in the primary studies, that's mostly quasi-experiments, often using difference in difference approaches. We have some studies looking at cross-country differences or different treatment intensities. So in that case, different prices per ton of emissions. And for the study quality, we really see that many studies are having challenges in the research designs to identify good control groups for the implemented policies. And also they rely on observational data, which is often aggregated to rather broad levels, so on national level or sectoral level, and also with low frequency, so often annual data. So we expect that the statistical power in these analyses is rather low, and we're planning to investigate that in more detail in the next step. To give you also a brief update of preliminary results of the quantitative analysis. So we did a meta-analysis of 50 studies. So we need to update that to our full set soon. We run random effects, meta-regression, and cluster the studies, the effect sizes on study level, because we extract more than one effect size from the studies. So here on the right-hand side, you see the effect sizes that we find, indicating significant reductions in emissions with some heterogeneity, which we will look into a bit further, but strong indication that there is some reduction effect of the carbon pricing policy. Thank you very much for your attention. Just as a last brief note, we are organizing with a Campbell group on climate solutions, a What Works event next year in Berlin, and hybrid on climate solutions. So if you're interested in that, please watch out for the invitations, which we will circulate soon.
Thank you, Niklas. And thank you also for being right on the clock. And it's great, obviously, to also see the What Works Climate Solution Summit for next year already being in the works. But yeah, are there any direct questions for Niklas? Okay, I don't see any hands or questions in the chat. But Niklas, if I can ask a question. So you mentioned you have a varying amount of study quality. Well, I think there is actually a question from the audience. I'll prioritize that. Leah, can you unmute yourself and ask the question? No. Okay. Okay, we have a question now in the chat again. So it says, can you go back to the findings slide and talk us through whether there were findings about what is the most effective in carbon pricing strategies?
Yes, let me share my screen once more. Yes, so we here look at the effects by intervention, but I also need to mention that some of them are looking at specific sectors and others are looking at the entire economy. And I guess maybe the question is hinting a bit towards this outlier here. So for the Regional Greenhouse Gas Initiative in the US, this is only studied for the energy sector. So it seems that in this case, the energy sector had quite a large reduction caused by the carbon pricing scheme. While for others, it often covers more than just a single sector. And that is an indication for differences by sector, but we've not yet investigated that in too much detail. So I would also still be a bit cautious about this result. I hope it's answering the question to some extent. But yeah, for the different strategies, I would not like to interpret too much into these results yet, because they're also using quite different research methods and all that. So I would be cautious to overinterpret the results there.
Okay, I hope that answers the question, Leah. You seem to suggest that the whole platform seems to have frozen for you. I hope that was an individual thing and it's better now. at least for me, it seems to be working fine. So I think I'll probably ask us to move on with the next presentation. So Farah, please go ahead and share your screen.
All right, did you see my presentation?
Yes, we do.
Okay, great. So thank you. I will thank you all. I'm Farah, Mohammadzadeh Valencia. I'm also at the MCC in Berlin. And similarly to Niklas, I am looking at questions surrounding carbon pricing, both direct and indirect in my case, meaning I'm looking at carbon taxes, but also fuel price reforms and fossil fuel subsidy reforms. And the question I'm curious about and that we're investigating in this paper is when these climate policies, these carbon pricing policies are designed, are there compensation mechanisms that could be included as part of the policy package that could affect public support for this sort of policy? And the motivation behind this is that we have seen protests against carbon pricing policies, and we're trying to find viable entry points for climate policies. And therefore, we want to understand what has been studied in the field of public support, specifically looking at compensation mechanisms. So we are investigating in this paper existing public opinion surveys that explicitly elicit respondents to rate, give a feeling, or respond to questions around a specific compensation mechanism for this policy. And however, we've seen that there's a systematic review that would let us know which compensation mechanism is most favored by a general public. And so the question that we're asking is, what is the relationship between public acceptance of carbon pricing policies and different compensation mechanisms? The studies that we're looking at are survey data. And we know there's a systematic review that looks at what factors influence the public, like whether it is their education level, whether it is that they believe in fairness questions. We know a little bit more through a systematic review what factors into the decision making, but we don't know specifically what kind of compensation mechanism is preferred by the general public overall. So similar to Niklas, there's a protocol that's being drafted. With ongoing updates. The literature search has come up with about 2,000 unique studies when looking at the Web of Science and Scopus. We also want to include Spanish literature language, so this will be an additional literature search that will be done in the future. Screening is also done using computer assistant screening. Text screening has been fully manual. So far, we have screened and coded 25 relevant studies, and it's still ongoing. And at this stage, we have identified 25 relevant studies, but we have extracted information for 16 studies, which represent about 19 surveys. And we have done some intermediate results, but really at this stage of the paper, we're mostly focusing on finding more data and coding. There have been some gaps that we've been able to identify already. Most of the surveys that have been conducted around carbon pricing policies and compensation mechanisms, or just in general about carbon pricing policies and public opinion, are mostly conducted in countries of the global north. When looking at compensation mechanisms, there are 5 that we have identified: direct transfers, green spending, tax cuts, general budget, and other. And the most tested for compensation mechanisms in these surveys have been for green spending and tax cuts, and not so much about direct transfers, for example, which has been anecdotally cited as a very popular way to increase public support. But surveys haven't necessarily elicited this as a possibility for public support in depth as with other compensation mechanisms. And really, we were also interested in looking at subsidy reforms, given that this also includes price increases for diesel and gasoline, for example. And there aren't any surveys that look at public opinion of these subsidy reforms. The methods in the
one moment.
Fine, thank you. The methods in the primary study are mostly surveys, which include either treatment controls, experiments or no experiments, and the quality of the surveys vary because the types of questions and the way the questions are asked are quite different. And not all of the surveys are perfectly nationally representative sample. Quantitatively, we are still preparing the analysis. We're having some challenges harmonizing certain information, such as what is the baseline scenario, and really what is the biggest question for us is how can we harmonize the acceptance measures that are used across all of these surveys. Some surveys have a 7-point Likert scale, some have an 11-point Likert scale. Some surveys give the respondents choices between A, B, and C. And now we're trying to figure out whether or not there is a good way to harmonize it so that we can robustly say that these results are comparative to each other. So if there's any feedback on that, really, that would be much appreciated. But basically where we are with this study is trying to figure out how to harmonize some of these challenges that we have come up, and of course, do more coding. If you have any questions, you can contact me at Farah at mcc-berlin.net. Thank you.
Thank you, Farah. Thanks also for being right on time. Do we have any direct questions for Farah? Please type them in the Q&A. I don't see any question as of now. Okay, Farah, maybe I'll ask one. Farah, you mentioned that one of the biggest challenges is harmonizing the responses. So what are the strategies, some of the strategies that people have used earlier for survey work? Because I think that's the most problematic sort of part of harmonizing with your criteria, right? Because surveys don't tend to have a standardized format for evaluation, which can be used readily for evaluation. So
yeah, I mean, when looking at other meta-analysis or systematic reviews, it looks they are happy to go with the results that come from the statistical analysis, which are usually probability logic kind of analyses, and just go by what the authors decided as the cutoff point for their measure, and then use the R values. But given that the measurements, like the original measurements, are so different, we still haven't really, like, this is still a question that we're asking, how to harmonize. I mean, I don't know what I haven't seen other methods. And we've asked another author from a systematic review how they did it. But they said they just used the R result. Like, they just used the R results and didn't worry about the harmonizing, because statistically speaking, this is how they have decided to move forward with it. But
okay, just in terms of feedback, maybe one way to think about it would be, and we've been discussing that with some of the work that we are doing in terms of just subsetting the data and looking at so much, the responses by subsets of what you can effectively harmonize and look as groups, and not synthesize the entire body of questions or papers you might have. Maybe that's
it's a very small volume, so the subsets are really limited. So we're really needing to harmonize, find some way to be able to look at all of them together as much as possible. But maybe I'll have more information on the data, like how much data there will be, and maybe there are some subsets, and But it's not looking so good on that front.
That's rather unfortunate, yeah. But yeah, I mean, I think this is a sort of typical problem with social science work, that we don't always have harmonization as a very easy thing to do. Okay, but I think we have to sort of move on, and we can come back to actually this maybe towards the end.
Thank you.
And it's actually time for me to present. So let me share my screen, and hopefully you all will be able to see it in a second. Okay, I hope now everybody should be able to see it.
Yes, but not in presenter, not full screen.
Not the full screen. I don't think any of us have been able to see in full screen mode till now.
Now it is possible. We see it now.
Okay, perfect, great. Okay, so I'm also going to be talking about pricing. So Farah, I request you to just interrupt me after 5 minutes, please. Thank you. I'm going to also be talking about an important aspect of climate mitigation solutions, and this is also pricing, but in terms of pricing of energy for households. So one of the key challenges or key solutions for decarbonization is renewable energy, but renewable energy integration, or using that renewable energy within the power system, is highly problematic, and there are several challenges or integration sort of challenges for renewable energy, simply because the sun doesn't shine always and the wind doesn't blow always. So you need to match somehow that supply with the demand. And one of the measures that's been suggested to effectively solve this problem is flexible pricing or dynamic pricing. What do I mean? Essentially, a lot of times, we have the situation where households are charged one fixed rate of electricity throughout the day and for all times of the year. In dynamic pricing, you could have something like a time of use pricing, where there's a peak period during which prices are higher, and off-peak where prices are lower. Or you could have something called as a critical peak pricing, where there is the utility identifies in advance, and you receive a message from your electricity provider that on this day, between these hours, there is going to be a critical event. So your electricity will cost more than usual. So please try and as an information. Or it could be we call real-time pricing, where your prices are actually indexed very much to the prices in the wholesale markets. And that's also though been tested relatively less. We've done this through analyzing two different strands of the literature. One is really the literature which is peer-reviewed and published. And we've been using a systematic review protocol and machine learning screening to go through them. We have identified about 40 studies with about 400 effect sizes. But beyond that, there is also a fair amount of evidence from also experiment-based trials, I would say, by electricity utilities, especially in the US. And the results of these trials are reported to the various electricity regulatory authorities in the United States by these utilities. And we have actually quite a fairly large data set, and the important thing to notice is that these studies or these reports, in terms of their methodology and setup, are very similar to what we see in the peer-reviewed literature. The only difference being that the reporting, so the experimental setup is the same, but the analysis techniques are somewhat different. And the way they report their results is obviously slightly different and does not necessarily always conform to the scientific, well accepted sort of scientific rules of what kind of statistics you need to report. But we have this really sort of exciting strand of gray literature, which we are also trying to synthesize with this project. I can share with you some of the preliminary results. So what you see here we're looking at this evidence. This is evidence from the peer-reviewed literature right now. And we're looking at it from two perspectives. One is really from the type of the intervention, so the time of the pricing scheme, where we actually find that critical peak pricing, so schemes where households are just basically told at a certain time of the day on a certain day, electricity will be much more expensive. That tends to be the most effective, or it has the highest aggregate effect size. Whereas something like time of use pricing is actually relatively lower in terms of the aggregate effect size. And surprise rebates for consuming less seem to be less effective even still.
5 minutes left. You have another minute.
Thank you. The other perspective that we're looking at is what is the outcome which is measured. So, and what we find is that the effect of these dynamic pricing schemes in reducing total energy consumption is somewhat, or is actually lower, but they're effectively able to reduce peak consumption, which from a renewable energy integration perspective and decarbonizing the electricity supply perspective is actually really valuable. There are issues with publication bias in this field, and I would love to come back and discuss this more. But essentially, what we see is that because all of these trials are designed for peak period consumption reduction, we also see that is where we find the most publication bias, or a stronger publication bias. Whereas in terms of the total consumption, which tends to be sort of the byproduct of running these experiments, there isn't not that much evidence of a publication bias. I think the challenge would be how to figure out publication bias in some of these metrics in the non-peer-reviewed literature. I think what is really important for us going forward is really to figure out how to compare from peer and non-peer review studies, and how to look at the publication bias within these two sort of distinct, relatively different strands of literature. With this, I'm going to stop. Thank you for listening, and I'm going to try and get back to the screen. Great. So are there any direct questions? No. Well, great. So I'm if there's nothing more that we want to discuss on this, then I guess we can move on to the next presenter, who's Paul. Paul, would you like to go ahead and share your screen?
Yep. Can you see that already?
Yes.
Okay, great. Thank you. Okay, so my name is Paul Lohmann. I am a postdoc at the L. Aaron Institute of Behavioral Economics and Policy, based at Cambridge Judge Business School. And I want to use these 5 minutes just to briefly introduce you to a large-scale evidence synthesis initiative where we are trying to understand how to harness the global emissions mitigation potential from behavioral change in households. And together with several research teams across Europe, we're developing an ecosystem of reviews which all follow a harmonized approach. So why are we doing this? Well, you might have seen that the most recent IPCC report included a dedicated section on demand-side mitigation. So this is basically emission mitigations which can be achieved by changes in social cultural factors, infrastructure use, and end-use technology adoption. And the authors synthesized empirical literature from a large number of studies to come up with these potentials across different end-use sectors. This is the figure that made it into the summary for policymakers, where actually the food sector has the highest demand-side emission mitigation potential, mainly brought about by social cultural factors. And across the other end-use sectors, we see that also infrastructure use and end-use technology adoption are very important. And while the IPCC has done a great job at quantifying this technical potential, there is still a lack of knowledge on which policy interventions work best to encourage behavior change. And that's exactly what we're trying to do with this ecosystem of reviews. We're trying to synthesize the literature that studies the effectiveness of policy interventions targeted at changing behavior at the individual or household level, and the outcomes have to have some sort of emissions mitigation potential. So I don't have much time to talk about this in detail, but we use the IPCC's Avoid, Shift, Improve framework to organize the ecosystem of reviews. And myself and colleagues at the Copenhagen Business School are working on a review that looks at avoiding food waste and shifting consumers to more sustainable diets. And then there are several other research teams, which include Tarun, who has already published a great review on interventions looking at reducing daily energy consumption in households. The MCC's also working on uptake of energy efficient appliances and shifts in transport behavior. And colleagues at the RWI in Essen are working on the uptake of end-use technology in buildings. And really important to us was that when we developed this project, we wanted to have a harmonized approach to our reviews, all of the reviews within the ecosystem. And so we started by jointly developing definitions of key terms of what is the population, how do we categorize interventions. And we also all used a common screening methodology, which has been mentioned a couple of times already, which is essentially an AI-assisted screening platform, which allows us to screen large quantities of literature and save time by using this assisted learning. We developed a common approach to risk of bias assessment, and we also jointly developed a set of harmonized decision criteria for screening to really ensure that there's some inter-review consistency of what we include and exclude into our reviews. I'll talk you through them briefly now. First of all, the population, which population are we interested in? We want to focus on behavior change in households or at the individual level. And this can be aggregated to slightly higher observational levels, such as canteens or dormitories. Interventions, we want to look at policy interventions targeting behavior change. And we categorize these quite broadly into 4 categories: monetary interventions, which might include taxes or subsidies, informational and educational interventions, behavioral interventions that include nudges or choice architecture, and finally, command and control regulation. We only wanted to include studies that have a valid comparison group to quantify behavior change against. That could be randomly assigned control groups in experimental studies or statistically constructed control groups in quasi-experimental studies or longitudinal studies as well. And very important to us was that we only include studies that look at actual behavior change or incentive compatible choices, and that these outcomes have something to do with emissions mitigation. So that excludes quite a large amount of literature that looks at hypothetical choices, intentions, willingness to pay. And we did this because we know that people's stated preferences are not always how they behave in the real world. And finally, I've already mentioned this, we wanted to focus on empirical data. And so we look only at experimental, quasi-experimental, and longitudinal designs. So just a brief preview going forward. We will, when all of the reviews within the ecosystem are completed, we will write a synthesis paper which brings together all of the evidence from the ecosystem of reviews This will allow a direct comparison between domains, which might look something like this, where we basically can visualize the average effect sizes of these interventions on behavior change in, for example, in the food domain, the buildings domain, or the manufacturing domain. We will, of course, conduct comprehensive risk of bias assessment for each of the reviews. And we will make sure to adjust for publication bias as well and have conservative reporting in this regard. We hope that this work will contribute to future IPCC assessment reports and also more generally help policymakers around the world better understand which interventions work best to encourage behavior change. That's all from me. Thank you very much. And please get in touch if you have any questions.
Thanks, Paul. Thank you for also sharing summarizing that rather large effort quite effectively in a short period of time. Do we have any direct questions? I'm looking at the chat, and I don't see a question right now. Farah, please go ahead.
Thanks, Paul. That's great. I mean, it's an ecosystem that's fantastic to look at all these different factors and to analyze them. Do you? I'm curious about the results, right? So I'm wondering, when do you think? Is there some sort of is this going to turn into living evidence? One. And two, do you know when most of these studies are going to be completed? Because it would be it would be very interesting to draw the conclusions, share them with policymakers.
Yes. I mean, I can speak for myself that I know that our review will probably be completed around, or we'll have preliminary results by the end of the year, so around December. We're still in the screening phase. I think Tarun has already made quite some progress with his reviews. One of them is already published. And it would, of course, be great to make these into living reviews, and that was discussed at the beginning. And it's something I think we do want to revisit at some point. But we are also aware of all the constraints and barriers more from sort of the infrastructure of publishing and how one would maintain these sort of reviews over several years is probably the main challenge, although the will is there to do this sort of project. It would probably be easier for something like a systematic map where we don't need to continuously update effect sizes and things like that. But it's something we would really want to explore, and maybe we can discuss further if you have ideas for that later. Thanks. Thanks,
Paul. I think we should move on so as to also get some more time for a short discussion in the end. So I'll request Tamzin if you would like to share your screen and present, please.
Great. Can you see that?
Yes.
Amazing. Hi everyone, I'm Tamzin and I'm a research assistant at the London School of Hygiene and Tropical Medicine. And I'm going to talk to you about an umbrella review that was part of the Pathfinder initiative at LSHTM. The Pathfinder initiative is a project which collates evidence on climate mitigation actions and their health co-benefits. And for those of you who don't know, an umbrella review is a review of existing systematic reviews. And by focusing on these systematic reviews, our aim was to identify the most robust prior evidence available on the topic of climate mitigation actions with health co-benefits. I'm not going to cover our results in terms of health outcomes and greenhouse gas emissions, but rather I'll be covering the methods used to synthesize the data, the challenges we encountered and what we did to overcome them, and how we think data reporting can be improved based on our experience. So our inclusion criteria were systematic reviews which considered studies evaluating a known climate mitigation action, a measured change in greenhouse gas emissions, and that had documented health impacts or exposures. Across multiple databases, we identified 6,902 records, of which 317 full texts were screened and 26 reviews were found that met our criteria. However, we found that the data reported in the reviews often fell short from the level of data required for our analysis. For example, 15 of the reviews we included were narrative and didn't attempt any quantitative synthesis, even when such synthesis was feasible. And also, systematic reviews with a quantitative synthesis often didn't report sufficient data from the primary studies that were reviewed, such as only reporting either health or greenhouse gas impacts of actions, but not both, or they were perhaps lacking in information on the baseline or the scale of impact, which are necessary to compare the impact of actions across studies and settings. However, these data were often available from the text of the primary studies. Therefore, we adapted the umbrella review methodology to expand our data extraction procedure beyond the text of the systematic reviews to the text of the primary studies that were synthesized in them. And through this process, we screened over 3,000 primary studies and included 57 in total from a variety of sectors. The sectors we used for the categorization of mitigation actions actually took a long time to formalize, so ended up being an outcome in of themselves. Most of the actions we came across in our data were simple to categorize and neatly fitted into one of 5 sectors, which was AFOLU, buildings, electricity generation, industry, or transport. And within these, we had single actions like a bicycle sharing scheme or multiple actions like a systems transition away from car use. There were also actions which involved more than one sector, and we looked to other frameworks to see how they categorize actions. But even there, some of our actions spread between 2 categories, while others didn't fit into any. And because of this, we created a category for cross-cutting actions, which either included singular actions impacting multiple sectors, such as a single carbon cap and trade policy, or multiple actions impacting multiple sectors, like policy packages. This gave us a clear framework with distinct boundaries where individual actions could be placed. Once we had the data, we needed to convert the time, scale, and units into a uniform format, which we could compare across actions. For time, we scaled everything down to 1 year or up to 1 year, which meant assuming that all actions had linear impacts and that a study done on actions in the 1990s, for example, would still be relevant today. Some studies were removed on the basis of not having clear enough timeframes. And in terms of geographical scale, all impacts were scaled to the national level, but only to the appropriate population. For example, city bike schemes were only applied to urban populations. Finally, greenhouse gas emissions and health outcomes were varied a lot in their type. So we converted them all into absolute impacts, often having to use multiple inventories for one action to get baseline data. Everything was converted to per capita impacts, as it allowed us to compare across countries, which often had very different contexts. And health impacts were converted to years of life lost using the global burden of disease data, and many studies were excluded for not measuring health outcomes. We also converted all measurements into CO2 equivalent. However, because some sectors we had were mainly measured in terms of CO2, it's possible that their environmental impacts are underestimates, as they didn't include any measures of methane or nitrous oxide, for example, which per kilogram heat the Earth's atmosphere more than CO2 does. In terms of what this means for us as researchers, we found that we need more consistent reporting of greenhouse gas emissions. We can't compare the climate mitigation measures in a robust way if we don't have the full breakdown of the gases that they reduce, and this makes it harder to recommend which measures are the most effective with any kind of certainty. There is also a need for better reporting of health impacts, as many systematic reviews were excluded from our umbrella review because of lack of quantified health outcomes, and indeed suggesting that there is a large body of evidence on relevant actions, but it's been synthesized in disciplinary silos, and so there is potential for their integration. There were also difficulties of comparability across the evidence, so studies were generally reported in a multitude of formats, often without clear baselines or interventions, resulting in many studies being excluded. We should therefore advocate for some formal structure to promote comparability and promote interdisciplinary work on climate mitigation. Something we as researchers are proactively doing to address this is hoping to create a living map of modelled evidence to show where there are evidence gaps, as well as trying to create better standards when it comes to reporting of greenhouse gas and health outcomes for climate mitigation actions. Thanks. That's the end of my presentation. And if anyone has any questions, do drop them in the Q&A.
Thank you, Tamzin. I see that. I think there is one question. Leah, would you please enter your question in the live Q&A chat, please, again? In the meantime, Tamzin, just to clarify, so you did actually go, traditional umbrella reviews really looks at the outcomes of the systematic reviews, but in your review, you actually went to the primary studies and really, in some sense, almost redid another review using all this information, right?
Yeah, we did. Because there was just the systematic reviews simply didn't report the kind of data that we needed to be able to bring them all together. They were often from different kind of disciplines, and it was just really difficult to gather what we needed to actually make any kind of conclusions, really.
Right.
Okay. Can I ask a quick question?
Hmm?
So did the health outcomes have to be explicitly measured or mentioned? Because I can imagine, for example, an reduce in meat consumption that maybe for environmental motives has a quantifiable health benefit, but probably you didn't attempt to somehow quantify that yourself.
Yeah. So we used the health outcome that we converted everything to was years of life lost. And if we didn't have a way of converting that, then we had to exclude them. There were some, for example, diet studies that reported kind of micronutrients and that sort of thing. But we didn't have the capacity as researchers to convert all of these vastly different way of reporting the different health outcomes to one kind of singular format. And we wanted to be able to look at kind of a broad overview of all of these different sectors.
Okay, great. I think we face exactly the same challenge, but in the other direction, because we want to include studies that have health motives, but have emissions mitigation benefits. And we're trying to come up with a way to harmonize and convert all of these different outcomes into climate metrics.
Yeah. I see Leah's.
Right. So Leah has a question, which I'll just read out as well for everyone. Regarding the measures of greenhouse gases, how many different ways of measuring did you find, and what were the most frequently used?
So the greenhouse gases that we were looking at were nitrous oxide, methane, and CO2. There was also ozone, which we ended up using as a health outcome because it can kind of do both, and we had to make a decision on, because we couldn't have it kind of as like on both axes, so to speak, as a greenhouse gas and as a health outcome. The most reported was CO2, and then we had nitrous oxide and methane, which were reported a lot less, and CO2 equivalent was also reported quite a lot. We also had things like black carbon and black smoke, but we didn't have a way of converting those to CO2 equivalent so that we could compare across all of the different sectors. Yeah.
Leah, do you have a follow-up? Okay, I think Leah has some follow-up things, but I'm going to just share that with Tamzin, and maybe you can follow up with each other later.
Feel free to drop me an email, or if you want any more info.
Okay. I'm going to just sort of try and pass along some of the messages that I'm looking at in the chat, which might be relevant for individual speakers. Okay, we have 5 minutes left for the panel, and I wondered if we want to think about as a group something that I had, as I listened through all the presentations, I came across around 2 things which I thought I was curious about. One, and I think Tamzin sort of ends it nicely by saying living reviews, but which I think, and I know that some of the people in the group are also planning. But one thing that I'm curious about is how do you, given that we are looking at different sets of literature with different methodologies, all of us, how do you understand the risk of bias or the problem that the primary studies or the reviews that you might be looking at may not really be up to the mark? And what do you do in your particular work to try and control for it? So I think a 1 minute quick answer from all of us, starting in the same order as the presentation. So maybe, sorry, Niklas, but you go first. Niklas, you have to unmute yourself, please.
I muted myself. Yes. So as I said, we tried to go with the Robbins I risk of bias assessment, which in our case was too specific for the broad set of literature that we had. So we tried to rather ask more broad questions on whether the control group is well defined and all that. So we hope we found a way to come up with a standard classification of risk of bias, but I'm sure that this is surely a branch that of the methods that we should also develop further in future, because it's
okay.
Yeah,
I'll have to
very
cut you
relevant.
off here and then pass it on to Farah. Sorry.
It's a point that I have only thought about as of a few weeks ago when we had the guest visitor at MCC and talking about the quality of studies. So it's something that I haven't addressed yet. So I will definitely be coming to Niklas and you, Tarun, for some more guidance on how to think about it with regards to my systematic review.
Okay, maybe I'll skip myself because I'm looking at the clock, and I'm going to pass it on to Paul and Tamzin, and then maybe end with my view on this.
Yeah, just very briefly, we haven't started coding that yet, and we were also thinking of using similar approaches, as Niklas mentioned. But I would really be keen to include additional or expand the traditional risk of bias assessments to also include more statistical qualities, such as statistical power and maybe other aspects of the study design and population. But it's something we will be starting soon when we do the full text screening.
Tamzin.
Yeah, so we haven't done any formal kind of statistical measurement of the bias, but we did find, for example, that we didn't have any low-income countries in our final review, and we are trying to address this by doing a living map of evidence and reaching out with partners to work on better reporting of data.
Thanks. From my perspective, what we have found is it's hardest to get people use consistently decent statistical methods in the work that they are evaluating. And there seems to be sort of no great way of countering that except for including that maybe as a moderator variable when you are doing the aggregate, when you're calculating the aggregate effects. And the other problem definitely seems to be publication bias, which does seem to have some new methods which are being suggested for correcting for publication bias, but they tend to work better if you have a slightly larger sample. But that's one approach that we are following to try and correct for study quality as well. We're really coming to the end of the session. And I thank everyone for presenting their work. One of the couple of presentations I've seen before, but it was really interesting to see everything else that the others were doing. Catherine has a question. I'm going to quickly read it out. Can I ask that you all publicize these ongoing analyses more widely so that we know what process is and what they may appear? Catherine, I think from the part of, I can answer on behalf of Paul, Niklas, and I that the publication protocols of these reviews are already on OSF. But we're also happy if you can drop us an email to share the protocols with you. And Tamzin and Farah, the clock didn't stop automatically, so I'll let you quickly also respond in case if you have an answer to this question.
I'm happy to answer for us. So our the protocol for our umbrella review is published, and yeah, I can send a link to that if you want.
Oh, I think she means if we can make, if I'm rereading her second question, how do we make sure that the results reach a wide audience is something which is what Catherine is trying to get at, like make more publicity around it, make sure that it's the outreach reaches beyond maybe whatever our circles, if I understood Catherine potentially well.
Yeah, I mean, we'll definitely keep that in mind and try and reach out to as many people as possible. That's always good for us. We've already extended the session by more than a minute. So I think this is a good place to stop. And I thank you all for joining in once again.
Thank you. Do we debrief afterwards, or is the session, are we just going to say bye to each other now?
I don't know if we have a separate. Let's see what happens with this platform once we end the session. Does it end automatically? I honestly cannot really tell you. Okay, sorry. With that, we'll have to stop. Thank you, everyone.
Thank you all.
Thank you.